This patch is used to prevent nausea and vomiting caused by motion sickness or recovery from anesthesia and surgery. It works by correcting the imbalance of natural substances that can occur in motion sickness and also blocks certain signals to the brain that can cause nausea and vomiting. It is not recommended for use in children. The usual dosage is to apply one patch behind the ear every 3 days. It is best to apply the patch at least 4 hours before the desired effect. Before using scopolamine, make sure to read the medication guide provided by your pharmacist. When applying the patch, make sure to press firmly for at least 30 seconds to ensure it sticks well. The patch should be replaced every 3 days, and if it comes off, a new one should be placed on a clean, dry, hairless area behind the other ear. If using the patch to prevent motion sickness, apply it at least 4 hours before the activity causing motion sickness. For surgery-related nausea and vomiting prevention, apply the patch as directed by your doctor, usually the evening before surgery. If it comes in contact with the eyes, it can cause temporary blurred vision and widened pupils, so always wash your hands thoroughly after handling the patch. After stopping this medication, you may experience dizziness, loss of balance, nausea/vomiting, headache, muscle weakness, or slow heartbeat. If these effects occur, report them to your doctor right away. And if your condition lasts or gets worse, make sure to inform your doctor. As your body adjusts to the medication, you may experience blurred vision and widened pupils. Other common side effects include dry mouth, drowsiness, dizziness, decreased sweating, constipation, and mild itching or redness at the application site. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. To relieve dry mouth, you can try sucking on sugarless hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. If you experience any serious side effects, such as mental or mood changes, difficulty urinating, fast or irregular heartbeat, eye pain, swelling, redness, vision changes, or seizures, remove the patch and seek medical attention immediately. While a serious allergic reaction to this drug is rare, if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so it's important to consult your doctor or pharmacist if you notice any other effects. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using scopolamine, make sure to inform your doctor if you are allergic to it or other belladonna alkaloids, or if you have any other allergies. It's also important to let your doctor know about your medical history, especially if you have breathing problems, glaucoma, heart disease, high blood pressure, seizures, stomach/intestinal/esophagus problems, overactive thyroid, difficulty urinating, mental/mood disorders, kidney disease, liver disease, myasthenia gravis, or uncontrolled pain. This medication may cause dizziness, drowsiness, or blurred vision. It's important to avoid alcohol or marijuana as they can increase these effects. Do not drive, use machinery, participate in activities that require alertness or clear vision, or consume alcoholic beverages while using this medication. It's also important to inform your doctor if you are using marijuana, cannabis. If you are planning to have surgery or an MRI test, make sure to inform your doctor about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. This medication may make you sweat less, which can increase your risk of heat stroke. It's important to avoid activities that may cause you to overheat, especially in hot weather. Make sure to stay hydrated and dress lightly in hot weather. If you experience fever, mental/mood changes, headache, or dizziness, seek medical help right away. If you are an older adult, you may be more sensitive to the side effects of this drug, especially dizziness and drowsiness. It's important to discuss the risks and benefits of using this medication during pregnancy with your doctor. Additionally, if you are breastfeeding, consult your doctor before using this medication. It's important to be aware of potential drug interactions with the scopolamine-based transdermal system. This may affect how your other medications work and could increase the risk of serious side effects. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with this drug include potassium tablets/capsules and pramlintide. Additionally, inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as alcohol, marijuana, antihistamines, drugs for sleep or anxiety, muscle relaxants, and opioid pain relievers. Also, be sure to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. And finally, be aware that this medication may interfere with certain lab tests, so it's important to inform lab personnel and all your doctors that you are using this drug. If the patch is chewed or swallowed, it can be harmful. If someone has taken too much, remove the patch if you can. For serious symptoms like passing out or trouble breathing, call 911. Otherwise, call a poison control center right away. If you live in the US, you can call your local poison control center at 1-800-222-1222. If you live in Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe drowsiness, mental or mood changes, like confusion or hallucinations, fast or irregular heartbeat, seizures, and hot or dry skin. This medication is for use on the skin only. Do not apply it to open wounds, cuts, or irritated skin. Wash your hands before and after applying this medication. Narration: remember, this medication is only for your own use. Apply it only on the skin and make sure not to put it on open wounds, cuts, or irritated skin. And don't forget to wash your hands before and after applying the medication. If you forget to change the patch at the scheduled time, replace it as soon as you remember. Do not use more than one patch at a time. Make sure to store the scopolamine-based transdermal system at room temperature and keep it away from children and pets. Do not store it in the bathroom. When it is expired or no longer needed, make sure to properly discard the product. You can consult your pharmacist or local waste disposal company for guidance on how to do so. Remember not to flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.